Good afternoon. Today I'm going to talk about a hot button issue that has resonated throughout the United States over the years. This issue happens to be physician-assisted suicide. Physician-assisted suicide is best defined as the voluntary termination of one's own life by a medical practitioner that administers directly or indirectly a medical prescription to a terminally ill patient that is of sound, competent mind. And this issue has staunch supporters on both sides of the fence. And as recently as October of 2014, it is once again in the forefront of American citizens' minds. And that is due to Brittany Maynard. Brittany Maynard was a 29-year-old Californian woman that was diagnosed with stage 4 glioblastoma. And glioblastoma is a cancer of the brain that has a survival rate of 6 months to 5 years. There is no known cure, and it features side effects such as loss of body movement, seizures, and excruciating pain. And because of the no known cure and low survival rate, Brittany Maynard decided to move to Portland, Oregon, because Portland, Oregon is one of 4 states that allows physician-assisted suicide. And Brittany Maynard, unlike most people with terminal cancer, was actually open about the situation. She went on social media to talk about her story, to try to campaign to legalize physician-assisted suicide throughout the country. And on November 1st, 2014, amongst her inner circle of family and friends, she died peacefully by using the drugs prescribed by her medical practitioner. So why is physician-assisted suicide illegal? Why isn't it throughout the United States more states willing to allow terminally ill patients to commit suicide? As recently as 55% of medical practitioners are in support of physician-assisted suicide. Over 42% of the common American is also in support of physician-assisted suicide. Yet, this practice is taboo in our country and still remains illegal. Those against physician-assisted suicide try to sound the competent mind as a reason to keep it illegal. They state that a terminally ill patient cannot make this decision for themselves to commit suicide because their pain is too excruciating, it messes with their brains, they're very depressed, and they believe their families and friends will think it's best if they just commit suicide and remain out of their lives. They're also fearful that family and friends may also take advantage of this situation and try to convince them to commit suicide in order to obtain money, benefits, and their estates. Yet this isn't the case. By utilizing a living will, it's proven that this method would be able to make physician-assisted suicide a doable process. For example, a Philadelphia man, 7 years prior to having life support pulled from him, dictated in his living will that he was not to be put on any sort of life support if he was a vegetable. Not even his wife could prevent this due to the verbiage. So by utilizing a living will, this would display a competent mind due to the fact that the person isn't of terminal cancer, they're not displaying any symptoms, their mind is sound, they're making these decisions on their own free will in case something like that was to happen. Furthermore, if physician-assisted suicide was legalized,